This video describes the techniques for targeting the three most widely used structures in neuromodulation to treat refractory epilepsy. Our first target is the anterior nucleus of the thalamus. And the first step in planning when targeting a deep structure is to co-register the MRI sequences with the stereotactic CT. To visualize the target, the most used sequences are STIR and T2, as demonstrated here. Due to great anatomical variability among subjects, indirect targeting should be avoided. The structure to be identified is the point where the mammillothalamic tract enters the anterior nucleus of the thalamus, as this area is related to better outcomes. If one goes back and forth on the coronal slices, it is possible to distinguish first the mammillary bodies and then the mammillothalamic tract, as confirmed on the axial and sagittal views. It is of extreme importance to address the vessels near the target, as they may limit the trajectory when implanting the electrode. The burr hole for entering the cortex is generally placed 1.5 to 3 cm lateral from the midline and 1 cm in front of the coronal suture, but this may be adjusted according to the safest trajectory. We should avoid major vascular structures and superficial and deep sulci. Two approaches may be used when targeting the anterior nucleus of the thalamus: the paraventricular one and the transventricular one. The first, the paraventricular one, has the advantage of going lateral and not through the ventricle. However, as it has a very lateral entry point, it is more challenging to correctly position the electrode inside the nucleus on the sweet spot. Therefore, we rather choose the transventricular one, as it is easier to place the interspace of the two center contacts on the target. After the trajectory and the entry point are defined, it is necessary to go down from the cortex to the parenchyma to identify the major vessels that will be encountered. The first vessel is the callosal marginal artery that may limit the trajectory medially, and after the ventricle is entered, there is the thalamus striatal vein laterally and the superior choroidal vein medially. Our next target is the Centromedian nucleus, which is a thalamic nucleus of the intralaminar group. As it is not directly visualized on the MRI, it is necessary to identify the anterior and posterior commissures in order to define the target. After fusing the T1 sequence with the stereotactic CT, the anterior commissure is visualized on the anterior wall of the third ventricle and the posterior commissure right above the aqueductus. It is also necessary to choose a midline point to correct the alignment of the images. The centromedian nucleus is located 10 mm lateral from the posterior commissure, at the level of the anterior commissure and the posterior commissure line. Once again, the burr hole for entering the cortex is placed 1.5 to 3 cm lateral from the midline and 1 cm in front of the coronal suture, but adjustments may be needed to avoid superficial and deep sulci and major vascular structures. Therefore, after defining the entry point, it is necessary to ensure no major vessel is crossed along the trajectory. The last target is the hippocampus, and this structure is readily visualized on MRI slices. Therefore, it can be targeted with direct anatomic methods. To identify it, a T1 MRI sequence with contrast is used. The first step when planning is to define an anterior point at the most anterior part of the hippocampus head in the coronal slice. The following step is to determine a posterior point at the middle of the hippocampus body on the sagittal view. After defining these 2 points, they are connected to generate a posterior entry point. This trajectory generally covers most of the hippocampus formation except from the tail, as it curves posteriorly and medially. A hard cannula, as the one used for the anterior nucleus of the thalamus and the centromedian nucleus, ensures not only an adequate electrode route, but also penetration within hardened structures as the sclerotic hippocampus. After defining the entry point, it is necessary to ensure no major vascular structure or superficial or deep sulci are crossed along the trajectory. Thank you.